you so much for joining us today. Today is a very, very serious show that we like to bring to you, and I think this is a discussion that we'll be seeing a lot more of over the next couple of years. What would happen if you found out that you were HIV positive, and then you made the conscious decision to have unprotected sex with your partner? How many people in this room would do that? How many people would have unprotected sex with their partner if you found out you were HIV positive? Would you do it? What if your partner came home and told you they were HIV positive? Would you continue to have unprotected sex with them? Would you stay with them? If you would stay with your partner, raise your hand. If you wouldn't stay with your partner, raise your hand. You don't know. All right, now, wait a second. So now we have one decision to be made, but what would happen if, let's say, after you realized that you were HIV positive, your partner decided to have unprotected sex with you, would you make a decision to have a child and bring a child into this world? Raise your hand if you would. Raise your hand if you would not. I want to see clearly if you make the decision. You would not bring a child into this world. Well, that's what we're here to talk about. Okay, again, everyone in this country is operating on some information that we've all been provided with. And right now, the stats show, I don't care whether or not you can tell me that there's 20 people who are alive who've had HIV for 20 years or not. Right now, the predominance of people who have HIV virus that turn to AIDS die. That's what happened. Hold on, that's the predominance. And so therefore, people's opinions are based on that information. And so we can clear up some of what we've been putting out here, which may be false information. Please welcome to the show Dr. Michael Hickson, okay? He's the Director of Medical Services for Addiction Research and Treatment Corporation. Thank you very much for being here, Doctor.
Thank you for having me.
Now, let's start. There's been all kinds of information put out here. One is the 90% chance that the child will not turn out to be HIV. True or false? Tell us what the truth is.
That is not exactly true, Montel. What we're talking about first is what we know. There's a lot about HIV disease that we don't know because it's a new disease. But we do know that all babies born of HIV-positive mothers will be positive at birth. That is because they currently have mommy's antibodies. We know that probably around 6 to 8 months they start losing her antibodies. Of those babies, 1/3 will be HIV positive and never change. They will keep their HIV positivity.
1/3, 30%.
That's correct.
Okay, 32%, okay.
Of the 2/3 that are remaining, 1/3 or 1/2 of the 2/3 will lose the antibodies and stay HIV negative. That means they will seroconvert and be HIV negative.
For the rest of their life?
For the rest of their life.
So now that's 33% will be HIV negative for the rest of their life.
That is correct.
Okay.
The other 1/3 is actually been exposed and infected, and they're developing antibodies, and you're in the window period. Right. That amount of babies will eventually go back to being positive.
Okay. So the truth of the matter is 1/3 of the babies born HIV positive. All the babies that are born of an HIV positive mother are HIV positive.
At birth.
At birth. 1/3 of them will seroconvert and will never face HIV for the rest of their life.
That's correct.
Another 1/3 have a possibility of seroconverting, maybe, maybe not, out of that group that's left.
That's the issue that she's bringing up. But generally you can say that 1/3 will be HIV positive and they will never change.
So 1/3 was, so you have it's really a 1 in 3 chance.
Yes.
Okay, so the bottom line is, the real bottom line here is that, as what we know today, though she had one child that seroconverted, this second child may not.
That's correct.
And that child may go on to carry HIV for the rest of his life and turn into full-blown AIDS down the road. We don't know.
And morally, look at the long picture that's one.
Yes, ma'am.
Montel, I really need to quote a study because a lot of people are confused about a study.
Sure.
What she's referring to, there was a study that has recently been done on HIV-positive women and their babies. They've been given AZT during the pregnancy, first PO and then intravenously. From those women, there has been shown that the risk has decreased from 28% to around less than 10%, about 8%.
8% what?
Yes.
8% that will seroconvert.
It was part of the study.
But
So what you're
you have to
saying is that
realize-
women who take AZT during their pregnancy, the babies have a greater chance of seroconverting once they reach 9 months or so?
That is correct. But first of all, this is a very recent study. Those women were very healthy with very high CD4 counts. They do not apply to a lot of people, and you can't extrapolate that to the general population.
Okay. Yes, yes, ma'am.
Maybe that had Down syndrome.
Okay.
Montel,
Yes,
a lot of times during the discussion I've heard that she's mentioned, well, I'm HIV positive and I don't have AIDS. What we do know, the statistics on gay white males, we know that, for example, all people who are HIV positive, about 2 to 4% of them will convert within two years to have AIDS. Within the next 7 to 10 years, 50% of those persons who are HIV positive will have AIDS.
Okay.
And we do feel in the medical literature that eventually, during some time period, everyone with HIV positivity
Oh,
will
okay.
be.
You could say to a woman who's sitting out there, a family in the same situation, what would it be? Make sure they have the true information, what?
I would make sure that they get the facts together and really realize that the complications that exist in HIV infection in her, as well as the baby, as well as family and friends.
Okay, all right, I got to tell you, I got to go with that. I don't know whether or not, let's put it this way, I know that we are not going to attempt to legislate, or no one's going to try to tell you what to do in your personal procreative life if you have the virus or not. But again, right now, what's going on in the society is that once you leave, unless you can find someone that's definitely going to take care of these children, the burden is on us. And so you're making the decision not just for yourself, but for your child, but for the society. And I'm not sure if that's a decision that we all want to make right at this time. We ought to have a lot more facts before we do that. Join us on the next Montel Show.